Thank you for that introduction, and thank you for the opportunity to present to you today. So this is a little bit of a slightly different sort of type of presentation to what we've just heard. What I'm talking about is an initiative that's really seeking to change the culture in terms of how we as consumers, but also as health professionals, how we think about healthcare and start a conversation about what's actually going on. So I just wanted to ask before I start in this room, I'm not sure of where everyone's from in this audience, but I'm assuming that we all have been to the doctor sometime in the last couple of years. I'd like you to reflect on the last time you went. Did you leave and think, oh, I really wish I'd asked more about what just happened then? Did you feel that maybe you didn't know what all the alternatives were and you didn't have all the information that you needed? Can I people put up their hand if they've had that feeling? And are there any clinicians in this room? I've got a couple. Well, I'd ask you to maybe reflect too, when you've had a patient in front of you, have you ever felt an expectation from that person that you should do something, even though you know that that's actually probably not the best thing, but the patient has an expectation that you do something? So those elements are really what I want to talk about today and what Choosing Wisely is all about. Oh, sorry, on the wrong buzzer. No. There we go. Push it harder. Okay, so I guess in the background to my conversation today is the fact that we have a problem in our health system, that there is a significant amount of waste. That's a problem in Australia, and it's a problem internationally. So what that means is there's a whole lot of things that are happening that aren't actually benefiting us as consumers and patients and aren't in our best interests. And then, of course, the problem with the flow-on effect from that is that we are being exposed to things that might actually be harmful to us. And the other flow-on effect from that is that it's actually wasting money in the system where we've got finite resources, and we'd like to make sure that those resources are being applied to things that are in our best interests. So we want to make sure that we're actually doing the things that are going to be of best interest to patients and not doing things that aren't actually of any proven benefit. There was a report that came out from the OECD last year that highlighted the amount of waste in the health system, and they flagged that as much as 30% of the things that are happening might not actually be of benefit to people. And these include things like unwarranted variations in practice. We know most people will be familiar with the idea that we have a significant problem with overuse of antibiotics, and a consequence of that is that we now have significant antibiotic resistance, which is a problem for all of us. And as many as 70% of adverse events reported in hospitals are potentially preventable. There are a whole bunch of things that contribute to waste in the health system, and some of that can be around systems and payment structures, and that's not what I'm here to talk about today. What I'm here to talk about today is really that human element, which I just asked you about at the beginning. It's really about those things that are within our control, either as a consumer in the health system or as a clinician in the health system, where people might not be receiving the right care because we're doing things that aren't necessarily aligned with latest evidence and best practice, where there might be duplication of services that are happening. We know that clinicians, as a general rule, they want to look after patients. They want to do the right thing that's for patients. But there's also, we know that there's a gap between that aspiration and the actual behaviour of clinicians. And I particularly point you to, there was some work done in the US where a group of physicians were surveyed and asked whether they felt that they had a responsibility as stewards to manage the finite health resources that we have. And over 90% agreed that they did, overwhelmingly said, yes, that is our responsibility. But when they were asked, would they accommodate a patient who really wanted a test, even when they knew that that test was not in that person's best interests, nearly 40% of those people said yes, they would. So there's a bit of a gap between the aspirational behaviour of the clinicians and the actual behaviour of what's actually going on. And that reflects the culture of what's actually happening in the health system. Similarly, in Australia, we've done some work surveying both GPs and specialists. And again, around over 90% of GPs and specialists agree that they have a responsibility to make sure that we're not doing inappropriate tests and prescribing medicines that aren't appropriate. Yet 60% of GPs and 44% of specialists cite that patient expectations are a major driver of them undertaking activities that they know are not actually necessary for a patient. Then we can top that with, we surveyed consumers as to what their sort of attitudes are around tests, treatments and procedures. And only 16% of Australians that we surveyed said that they request tests when they go to their doctor. So there's a bit of a gap between what consumers think they're portraying when they're having a conversation, when they're having a consultation with their health professional, and what health professionals actually perceive is going on. So we really need to be having better conversations in that relationship as to what's actually needed. And that's really at the core of what Choosing Wisely is all about. So Choosing Wisely is an initiative that started in the US in 2012. And what it seeks to do is really promote better conversations between both health professionals and consumers about what care is really necessary. So you're making sure that people are getting things that are supported by evidence, they're not duplicating things that aren't necessary, and ultimately you're reducing people's exposure to harm from having something that isn't necessary. And we heard earlier about this idea of incidentalomas and the consequences of if you're having imaging and looking for something when it's not actually required, you can often put people on a bit of a treadmill and go down a bit of a path that isn't actually necessary, chasing something that isn't needed. So Choosing Wisely started in the US in 2012, and what they did was, at the outset, they challenged health professionals. So there was a general conversation happening at the time about the fact that there was a whole lot happening in the health system that wasn't actually evidence-based and needed. And there was an ethicist called Howard Brody who actually put out a challenge to health professionals and said, you know the things that are within your area of remit that aren't always evidence-based that your colleagues are doing. So why don't you come up with a list of 5 things in your area of specialty that should sometimes be questioned? And so the ABIM Foundation in the US ran with that concept, and they engaged initially a small group of colleges who put out their lists of 5 things to question from their area of specialty. And now, 5 or 6 years later, they now have over 90 colleges and specialty societies on board who've put out their own lists of recommendations of things to question within the health system. And it's now an international movement. So 1/3 of all OECD countries around the world have a Choosing Wisely movement, and it's active in over 20 countries around the world. There are some core principles around Choosing Wisely which I think have contributed to the reason why it has been picked up in so many countries. And the first is that it's intentionally clinician-led. So this is saying to clinicians, you are the people with the clinical knowledge and expertise to know what is appropriate in terms of management of different conditions. So you tell us what are the things that you are doing that aren't evidence-based and aren't appropriate, and you drive this. So it's empowering clinicians to really take a leadership and an ownership role in the work that they're doing and in quality improvement activities. It's all about improving quality of care for patients. This is not a cost savings, cost reduction exercise. Of course, if we get it right and we stop doing things that aren't necessary, it frees up resources that can be applied to high-value care. But that is not what is driving this. This is about improving quality of care for us as consumers by not doing things that aren't necessary. It's evidence-based. It's multi-professional. So it's recognising that healthcare doesn't exist in a system, and so it encourages people from all disciplines to actually get involved in the initiative. And the processes by which colleges develop their recommendations and publish them is transparent as well, so that there's that visibility about the process that's gone into developing up lists of things to question. And these principles are really seen very much as the critical non-negotiable success factors for Choosing Wisely. So this is an example of some of the recommendations that have come out as part of Choosing Wisely in Australia. And I should say, so Choosing Wisely launched in Australia in 2015. And so this is an example of a recommendation from the College of Radiologists. And so one of the recommendations is don't request imaging for acute ankle trauma unless indicated by the Ottawa ankle rules. So it's really important to show that this is saying it's a do not do, but it's a caveat. So it's recognising that most things are useful in certain applications, but what we want to avoid is large misuse where it's not appropriate. And again, reflecting on David's previous conversation around imaging for low back pain, it's probably no great surprise to you to find that several Australian colleges have put out recommendations around avoiding use of imaging for particularly acute low back pain in the absence of indications. So it's highlighting that that really is a problem that's happening across several disciplines that we need to look at. So all the recommendations have a description. They also have published with them the process by which the colleges have developed those recommendations as well. So how they've consulted with their members to actually get feedback. They're all evidence-based, and the evidence that support the recommendations is also published and made available with the recommendations, and they all have a quality of care focus. Most importantly, the actual process of developing the recommendations is as important as the recommendations themselves. So it brings it back to this idea that choosing wisely is all about starting a conversation. And so when a college signs up to be part of choosing wisely, what they're doing is committing to having a conversation with their members about what things that are happening within their area of remit that might not always be evidence-based and appropriate. And so thereby they're starting that conversation. And for some colleges that we've worked with in this initiative, it's the first time that they've actually been having those conversations about what they're doing that might not always be appropriate. The other key resource associated with choosing wisely is a list of questions that we encourage the general public to ask when they go to the doctor. And this is all intentionally an empowerment tool to make sure that you're leaving that consultation with the information that you need to make an informed decision about what's right for you. So the questions include things like, do I really need this test, treatment or procedure? So that's about, well, if I have this, how will it actually change what's happening to me? How will it actually add value to my treatment pathway? What are the risks? We often don't ask that questions. Are there simpler and safer options? What happens if I don't do anything? And I think this is a really interesting one because people often feel that if they leave a doctor's appointment without a recommendation for a referral for a test or a prescription, they feel like nothing's actually happened. But actually, usually what has happened is that they've been asked to do some watchful waiting or some monitoring, but people feel like they haven't been given any guidance or anything to validate their concerns. So what we're really saying is have a good conversation about what you do want a patient to do, but it might not necessarily mean having a test or a prescription. And then we also encourage people to ask about the costs. And that's not necessarily just about dollar value costs. It's about what's the cost for someone in terms of their time and their emotional commitment if you're subscribing them to a particular course of treatment as well. And so these questions are made readily available for people to use and take to their doctor. But also what we're finding is clinicians are using them in their conversations with each other in hospitals to actually question and discuss, well, actually, is this actually valid? Is this necessary? And why are we doing it? So I mentioned before that Choosing Wisely came to Australia in 2015, and NPS Medicine Wise, the organisation that I work for, we're the facilitators of Choosing Wisely. So we're a national implementation organisation. We've been around for 20 years, and our whole mission is around supporting quality use of medicines and tests. And so we have been supporting this program. Since it started, we've had a significant engagement with health professionals around the country, but also with consumers. And it's been really interesting to see how this initiative has taken off. Our principal role is as a facilitator of the initiative. It's very much a grassroots campaign where we're trying to get other organisations to be involved and do the legwork, because we're trying to change culture. And that can only come if each organisation is buying into it and contributing to it. It can't come from a unidirectional push in terms of the messaging and information. So our role principally is around, we create forums for sharing and learning. So we hold regular forums where we bring together the colleges who are involved in the initiative to share ideas and information about what they're doing with regard to their involvement with Choosing Wisely. We do a significant amount of work in terms of spreading the word with both the general public, but also with a number of our stakeholders around what we're doing with the initiative. We're a national implementation organisation, as I mentioned, and so we're embedding Choosing Wisely into our programs, and I'll talk a bit more about what we're doing in that space. We're also got to focus on evaluating what we're doing, and I'll also give you some examples of some of that. And we have an advisory group of clinicians and consumers that inform on the initiative and really set the direction in terms of the strategy for the campaign. So where we're up to, we now have 40 colleges, societies and associations in Australia have signed up to Choosing Wisely. So that's 80% of Australia's medical colleges are on board. We also have 3 consumer partners who, particularly, and Consumers Health, which includes Consumers Health Forum and Health Direct, who we do a lot of work with. And increasingly, we have a base of what we call champion health services. So basically, they're health services and hospitals who are very keen to adapt the principles of Choosing Wisely about reducing unnecessary care and adopting a much more patient-centred approach, who've approached us and wanted to be involved in the initiative. And so that's a membership that's growing, and I'll talk a bit more about the work that they're doing. We do a lot of work in media, and we track our reach in that. And so in the last year, we had over 1,000 general news reports and reached over 6 million Australians with that. We also track our awareness of the campaign year on year to see what visibility people have around it. And in our last surveys, we found that GPs surveyed, there was 59% were aware of the initiative, and with specialists, we were up to 49%. So we have a lot of work to do in that space, but it's growing in terms of awareness. So I mentioned that we do a lot of work with the media, and it's been really interesting that even though it's a very competitive space to get stories in the media, it actually is a story that really resonates with people. We've had a number of journalists who are very interested in this story because it's often the first time that they've even thought that, oh, there are consequences with actually doing things. I've had a number of journalists say to me, I always just thought that the more tests I had, the better. I didn't realise that there could actually be a negative consequence to that. So there's been a lot of appetite to hear more about the initiative. And we've also had the support of groups like the AMA and, as I said, the leading medical colleges in Australia in terms of getting the message out there about the importance of having good conversations about what healthcare is really necessary. It's multi-professional, so of those colleges and societies that we have on board to date, hugely diverse in terms of ranging from the College of Physicians and all their subspecialties through to pharmacists, physiotherapists, nurses, pathology, radiology, ophthalmology. So it's a very multidisciplinary membership that has come on board. And after they've developed their lists of recommendations of things to question, what they're now focused on is thinking about how do they embed this into what they do as their business as usual. So how do they start to change the culture within their area of remit about how you think about healthcare? So, and their area of remit is around really education and communication with their members. So they're looking at how do they embed the principles of Choosing Wisely into training and even exams for their members. Groups like the College of GPs have developed, when they're updating their guidelines, so for example their Red Book, which is around preventive health in primary care, they've included a number of the Choosing Wisely recommendations into those guidelines. So they're looking at ways that they can actively embed the messaging and the principles of Choosing Wisely into their business as usual activities. The College of Surgeons have actually partnered with Medibank and are providing feedback back to their members on their utilisation of certain surgery items. That's meant purely as a reflective tool for those members, but it gives them an opportunity to reflect on their practice and think about whether what they're doing is actually appropriate or not. I mentioned that NPS is a national implementation organisation. So what we do, we roll out 3 national programs a year in primary care, where we go out and do face-to-face visits with GPs around the country. We have a nationally distributed field force. And so within each program, we will do face-to-face visits with between 6,000 and 9,000 GPs, but they're multi-dimensional programs too. So we have online CPD activities. We provide feedback out to GPs around their prescribing or requesting behaviour as well. And we also develop patient resources as well. So when we're now thinking about our upcoming programs, and these all have a quality use of medicines or tests focus, and we're looking at where there are evidence practice gaps and where education and academic detailing can benefit that, we look at where we can promote the messaging around Choosing Wisely as well. And so recently we've rolled out a national program with GPs around appropriate management of people with acute knee and ankle injuries. And what we found prior to rolling out that program, when we surveyed GPs, there was really varied knowledge around the Ottawa ankle rules, and ankle and knee rules. And so for people who don't know what those are, they're basically a physical assessment that you can do to determine whether it's actually in a patient, whether you actually would benefit from running a test, doing imaging to actually identify the cause of the problem with those individuals. And so if people don't follow the Ottawa rules, you can imagine that there might be a whole bunch of testing that's happening that might not be necessary. Following running our program, we've found a significant increase in awareness of the Ottawa rules, increased knowledge of the appropriate care path. Importantly, increased confidence in actually having a conversation with the patient in front of them about why testing may not actually be necessary and helpful for them in that instance. And we're looking at currently evaluating that program in terms of actual changes in utilisation of those associated imaging items off the back of that program. And this has now become our sort of business as usual, looking at choosing wisely recommendations in our programs. And we're currently developing a program around acute low back pain, which we'll be rolling out later this year as well. I mentioned before hospitals who'd been really keen to get involved in choosing wisely. So shortly after we launched, we were approached by hospitals who said, how do we get involved? We want to do this. This is really important to us. And so we developed a framework that would allow hospitals who wanted to be a Choosing Wisely hospital to work within that framework of those key principles about being clinician-led and evidence-based and focused on patient care, and then really left it up to them to say, okay, well, you go away and think about what you want to do. And that group has really grown. So we now have 25 health services around the country who are on board. And what they've been doing is really looking at their own activities, and it's about, I guess, locally contextualising the message of Choosing Wisely. So it's looking at the Choosing Wisely recommendations and looking at whether those health services are actually doing anything that's not appropriate. But it's also giving clinicians an opportunity to have a voice around what are they observing that's happening in the health service that might not be evidence-based and in line with guidelines, and giving them a voice around thinking about how they might change practice. And that is often a big culture change, because often the clinical improvement activities are driven from a top-down perspective where it's been mandated that these are the areas that clinicians need to work in to change practice. So this model is actually giving clinicians a real sense of ownership and empowerment about how they can actually improve the way that things are done. What's happening is, it's as much about what they're doing as the way they're doing it. What they're now starting to report is they're showing significant reductions in areas of unnecessary pathology testing, for example, where they were seeing huge amounts of repeat testing that wasn't necessary. And the benefit for that is that patients are now not having as many blood draws as they had to have before, which if you're a patient in hospital for a long time is a significant benefit to not constantly be having to have blood drawn. But it's also freeing up clinician resources to actually work on things that are of higher value. They're also looking at how they embed the principles of Choosing Wisely into things like performance frameworks. So a number of the health services are now mandating to say, we're a Choosing Wisely health service, which means we encourage you to talk with your peers about whether this test, treatment or procedure is actually of benefit to the patient and how is it going to change how you manage that patient, and really encouraging those conversations. So new junior doctors that come through, they get that information to them. And importantly, health services are now really starting to think about how they work much more closely with consumers. And one health service I spoke to recently said they actually engaged their consumer group in thinking about where there were areas that needed to be improved in the health service. And in the area of wound management, where they had a number of patients who'd been through the hospital being treated for wounds, they identified a whole bunch of things that they identified that they didn't think were necessary and were actually wasteful, that the clinicians then ultimately agreed on but hadn't actually noticed. And so it really highlighted the benefit of actually engaging with consumers in actually identifying what's actually necessary and what's actually in a patient's best interests. Simple example that I really liked from Royal Brisbane that they did was they have a real problem with the shortage of O-negative blood. It's a really rare, valuable resource, and they were wasting it all the time. Because when someone was going in for surgery who might need a transfusion, they were taking the blood out of the freezer, and then by the end of surgery, they'd realised they didn't need the blood had been out of the fridge too long, and it was wasted. So that's a waste of finite resource that might not be available for someone else. And so it's disrespectful for the person who's donated the blood, but it's also putting the next person who's O-negative who comes through the door at risk because there's not as much blood going available. So what they did was actually a simple thing. They just put a stopwatch. Every time now blood gets taken out of the blood freezer and into surgery, they attach a timer to it and set it for an hour. And that timer goes off in the middle of surgery, and by that time, when the timer goes off, they make a decision. Are they going to need that blood or not? And when they don't, they put it back in the fridge. And they've managed to avoid all wastage of O-negative blood since that intervention. And it's just a really simple thing, but it's about reducing waste in the system and really having a better system that's actually going to be more advantageous for patients. Better Care Victoria, Safer Care Victoria, who are part of the Department of Health and Human Services in Victoria, they have been really excited about the work that's happening with the hospitals, and they are funding a scale-up of Choosing Wisely across 11 health services in Victoria at the moment. This is really early days, but what they're really interested in is taking the learnings from Austin Health, who are one of the first health services that we started to work with, who've really shown significant changes in terms of how they do things in that hospital off the back of their program. What this program with Safer Care Victoria will do is look at how scalable and transferable those learnings are to other health services, and how are we able to transfer those behaviour changes to other and also different types of health services. So taking something from very much a major metropolitan health service into more rural and regional health services. So that's a 12-month program, but it's really exciting to see that commitment from State Health Department to look at how we actually support bringing about culture change in terms of how we deliver healthcare. Choosing Wisely is all about improving things for outcomes for consumers. And so we've worked very closely with a number of consumer partners, including Consumers Health Forum. And we've partnered with consumers all along the way in terms of developing tools and resources and messaging. We're currently doing some work with Consumers Health Forum in terms of really how we adapt what we've done in the health services in the hospitals to how we can adapt that for primary care, because we're recognising that's the main place where people have an interaction with their health professional. So how do we get that messaging out there about encouraging better conversations between clinicians and patients about what care is really necessary? So we look forward to presenting on some of that work going forward. As part of our work with consumers, we've done a lot of focus groups and interviews to find out what people's attitudes are around asking questions. How aware are they that there are risks and benefits? And when we show them the 5 questions, generally people say, yeah, look, I think that's a pretty good idea, but actually I don't feel like I have permission to ask questions. And so what we've been doing is a lot of work with those hospitals and health services to say, how do we create permissible environments so that people feel like they actually are empowered to ask questions? I've had the CEO of a major health service tell me a story of her mother who suddenly was ill and had to go to a hospital that wasn't her hospital. And she said, I was standing there as the CEO of a major health service. I should feel really comfortable in this environment, and I did not know what questions to ask, and I didn't know who to ask, and I didn't know how to ask it. So a lot of the work we're doing is thinking about how do we really empower patients to ask questions, and a lot of that comes from the culture of the hospital or the GP practice in terms of how do we create an environment where we're letting people know that it is okay to ask questions. Finally, I just want to talk about this story. So this is a couple, John and Jonette, and I met Jonette at a community forum up in the Hunter, New England area in New South Wales a couple of years ago, and I was talking about choosing wisely. And at the end, she stood up with the 5 questions in her hand, and she said, thank God for the 5 questions. And I thought, gosh, okay, that's pretty impressive. And then she told me this story where she had been at a community forum where they were promoting the 5 questions, and she'd taken it with her and taken it home. And then not long afterwards, she had taken her husband to see a specialist, and it was a new specialist to them. And he's a man who'd had a lot of vascular problems with his legs, and I'm not going to go into all the details of the problems, but basically the conversation started with that specialist, where that specialist started making recommendations that from their perspective seemed to conflict with previous advice that they'd had and were incredibly invasive. And Jonette thought, oh no, I've got my 5 questions, I can ask them. They started to ask them. That surgeon was actually not happy to answer those questions. And so Jonette left, and she thought, actually, that's not okay. And so she went back to her GP and asked for a referral to another specialist who was happy to take her through the 5 questions. And they did talk about what the alternatives were and what the options were. And they ended up with a very different course of action for John, which wasn't invasive, that aligned with the values for both John and Jonette in terms of what their expectations were about his care. And they were all very happy and satisfied with the outcome. And I think that's a really nice example of what we're trying to do with Choosing Wisely. It's about empowering people to actually know the risks and benefits, know the options, and with a shared decision with their clinician, come up with options that are better for them. So I wanted to just finish on that. And then finally, I just wanted to let you know, if you want to find out more about the initiative, it is all about a member base and working with organisations to get the word out there, both with clinicians and consumers. So please go onto the website. You can get in contact with us through there, and we'd love to hear from you. Thank you.